This segment is brought to you by the Southeastern Spine Institute.
Welcome to Southeastern Studios, where we learn about the latest in medical technologies and sit down with physicians who are prominent in their field. Today I'm sitting down to talk with Dr. Dr Polletti from Southeastern Spine Institute. How are you doing today?
I'm doing great, thank you.
Wonderful. Now, tell me a little bit about yourself. Where are you from? What you do?
Well, I am a spine surgeon here at Southeastern Spine Institute. I've been here since the beginning.
Since the beginning
for 30 years now, since Southeastern Spine Institute started back in 1991. We were the first medical center just to focus solely on spine problems, focusing on this concept of having everything under one roof. That's how things started and have grown to where it is today.
That's what I've been hearing a lot about. It's a collaborative effort, and that's kind of one of the benefits that you guys have.
Right. There are doctors from different specialties all working, just treating spinal problems.
So that's primarily what you do?
Right. That's what I do. I'm a spine surgeon. And so most people that come in don't require spine surgery. Most people that come in can try some type of non-operative option like physical therapy or an injection. But when it does come down to surgery, and that's hopefully a rarity, that's where I come in, yeah.
Now, sometimes it's a little daunting to have to go to the doctor when you're having pain, but we've been talking about, not waiting whenever you're experiencing some sort of pain.
Right. Finding out what it is the most important thing, finding out not just what it is, but what it's not. And so, important to get in there and get it checked out, the sooner the better.
Could you walk me through a day in the life of Dr. Polletti?
Well, I mean, a surgeon's life starts early. We rise before the sun does almost routinely. Typically, there are patients that we see in the office, there are patients that are in the hospital, and then it includes both being in the office and seeing patients in surgery every day. So, pretty good day, pretty long day.
Now, you were saying that you've been with Southeastern Spine since the beginning, but was there a moment where you kind of knew that this was what you wanted to do?
Well, sure. We went into spine surgery with the focus of keeping everything in a single specialty. So we started in the surgery center, in the ambulatory surgery center, more than 20 years ago. We started with outpatient spine surgery, and we were able to use modern surgical techniques, making smaller incisions to split structures such as muscles so that we can look through a microscope to do this surgery through a smaller access than we ever could before. So now at the Southeastern Spine Institute Surgery Center, there are doctors in many specialties that do minimally invasive hip replacement and knee replacement and sports medicine surgery, and that's really how things have modernized here, especially in the last few years.
And that makes a huge difference with the patients, right? With recovery time and, just having a smaller scar too.
Right, having a smaller scar is always nice, but through that smaller scar we're doing less dissection, and so people truly are able to get up and go home. It's just unheard of to think that somebody could have a hip replacement and go home a couple of hours later. It's unheard of to think that somebody could have an operation to replace a disc on their neck and be home before lunch, but these minimally invasive techniques have allowed us to go there, and it's just been the culmination of this 20 or 30 year experience. Now we're able to see it not just in spine, but in these other specialties.
I gotcha. And what would you say is the most rewarding part of your job?
The most rewarding part of my job is making a difference in people's lives.
Now, if someone is experiencing pain and want to come in and see you, how can they do that?
Well, you can come right in or call the Southeastern Spine Institute directly. I think traditionally a lot of people have thought that they need to have a referral from their own doctor, and while that's always helpful, and we see a lot of referrals from doctors, patients can call directly and make their own appointment, and if you have a back problem, you're exactly right. There's no reason not to wait and find out exactly what's going on.
All right, thank you so much, Dr. Polletti. If you guys want more information, you can go to southeasternspine.com. Thanks for joining us for another segment with Southeastern Studios, and as always, you can learn more information at southeasternspine.com.